According to the studies, autism spectrum disorder (ASD) is a disorder that affects basic human characteristics such as social interaction, the ability to communicate thoughts and feelings, imagination, and the formation of connection with others. Autism is a neurological developmental condition identified by behavioral and developmental characteristics. The neurobiological causes are still under research, but autism is a result of the effects on causes developing brain of prenatal factors. Autism is defined best as a spectrum of illness distinguished only by the severity of the symptoms. The age at onset and association with coexistent disorders include epilepsy, mental retardation, and specific language delay. Other studies investigate the underlying neurological mechanism of autism, focusing on brain structure, function, and development. By identifying autism earlier, we can provide target support and therapies that significantly improve outcomes. Not only that, when we study about autism spectrum disorder, we can have a better treatment.
I will discuss key insights into autism spectrum disorder, focusing on neural connectivity, genetic factor, and behavioral manifestation. Autism is regarded as a neural connectivity disorder where reduced synchronization among crucial brain regions affects social cognition and related function. Thus, overconnectivity with local brain areas and diminished connectivity across long-range circuits, especially in the frontal and temporal cortex. Specific brain regions such as the fusiform face area, inferior frontal gyrus, and amygdala are crucial for social cognition. Dysfunction in this area contributes to theory of mind deficits, making it challenging for individuals to understand other thoughts and emotions. Genetics play a significant role with mutation in neurodevelopmental genes like SHANK3 and others impacting synaptic information and connectivity. This results in improper synaptic connection and abnormal cortical organization. These neurological disruptions lead to behavioral manifestations such as repetitive behaviors and cognitive rigidity, linked to long-range overconnectivity and impaired emotion perception, and executive integration, linked to social overconnectivity. Despite the absence of a cure, early diagnosis and intervention can significantly improve outcomes for individuals on the spectrum.
Today, I want to emphasize the importance of comprehensive support for individuals with autism. Autism spectrum disorder presents unique challenges, but with the right interventions, we can greatly enhance their quality of life. Firstly, applied behavior analysis or ABA stands as one of the most researched and effective therapies. It uses structured techniques to teach crucial skills like social interaction and daily life routines. Additionally, speech and language therapy plays a pivotal role in improving communication abilities, while occupational therapy focus on developing essential motor skills like life abilities. Medications can also assist in managing associated symptoms such as anxiety and hyperactivity, significantly improving overall well-being. Educational support through individualized education programs, which is IEPs, ensures tailored educational plans that promote academic and social success. Supportive therapies like sensory integration and social skills training further aid individuals in navigating their environments and improving interactions with others. Lastly, a supportive community is essential. It fosters understanding, acceptance, and inclusions, crucial for individuals with autism to thrive. Together, these interventions create a holistic approach, empowering individuals with autism to reach their full potential and enhancing their overall quality of life. Thank you.
The neurological and genetic underpinning of autism spectrum disorder. In some research, the social brain in autism spectrum disorder affect specific part of the brain that handle how we recognize face, understand emotion, and interact socially. Besides that, neural connectivity in autism spectrum disorder, which hyperconnectivity and hypoconnectivity may cause social cognitive challenge, whereby people with autism spectrum disorder might experience too much or too little activity in certain brain area, by this affecting how they process sensory input and social cues. Other than that, the genetic also the factor of autism spectrum disorder, which genetic mutation affect brain development may impact neural and synaptic function, whereby some research say that certain mutation can disrupt brain development and influencing how neurons communicate and function. Moreover, emotion response and brain activity may reduce brain activity to fear and happiness, which some research say that individuals with autism spectrum disorder might react differently to emotion phase due to varied brain activity in area like the amygdala. Next is theory of mind in autism spectrum disorder, which is difficulty understanding others' thought and feeling, which is a challenge for individual with autism spectrum disorder is grasping the mental state of others. However, it also changed the brain frontal system may influence certain brain in ASD, including patterns of repetitive action. Other than that, the genetic also the factor of autism spectrum disorder, which genetic mutation affect brain development may impact neural and synaptic function, whereby some research say that certain mutation can disrupt brain development and influencing how neurons communicate and function.
The brain regions that are frequently co-activate across a variety of social tasks are called as social brain. In some research, the amygdala or typical related area are involved in expressing the shape, motion, and abstract elements of living things. When looking at autism, certain parts of the brain are often bigger. For example, the cerebral hemisphere and parental temporal lobe. It kind of having a balloon inflates more than it should. Recently, studies have shown that there might also be changes in other areas such as corpus callosum, hippocampus, and amygdala. In these studies, it also stated that even after complete brain adjustment, lower hippocampus measurement had been observed in male, juvenile, and adult autistic individuals who are primarily highly functional if compared with age and gender matched health control. Autism is associated with a wide range of different structural brain that affect several different areas and systems. The wide variety of symptoms and behaviors associated with autism can be attributed to these structural abnormalities. The cerebellum, the amygdala, and the prefrontal cortex among the brain regions that are affected by autism. These areas are critical for motor abilities, emotional control, and social interaction. According to the studies, there are still some discrepancy among MRI studies examining cerebral hemisphere size, increases in total brain, parental temporal lobe, and cerebral hemisphere volume in individuals with autism have been replicated by several well-designed MRI reports with satisfactory methodology. Theoretically, anomalies in this structure may contribute to the impairment of specific skills associated with autism, such as aberrant reaction to emotional cues, high order cognitive, social, and information processing that could help the autism.
So, for the conclusion of this topic are genetic and neurological causes of autism spectrum disorder (ASD) explored in this topic. As we know that ASD is related to social brain networks involving specific brain regions crucial for social cognition. Individuals with ASD exhibit both hyperconnectivity and hypoconnectivity in the brain, impacting social and cognitive processing. Limited connectivity in certain brain areas hinders social thinking tasks and contribute to hallmark social deficit observed in autism. For the genetic factors and brain development was playing a significant role in modulating the development of brain network in autism. For the social brain networks play a role in autism influenced by genetic abnormalities. Autism spectrum disorder involves severe difficulties with social communication and interaction. For the brain structure differences in ASD, individuals with ASD show significant differences in weight structure, real connectivity networks compared to control and ADHD. So, while there is no cure for autism, a combination of early intervention, therapeutic strategy, and community support can significantly improve the lives of individuals with ASD, enabling them to reach their full potential. So that's all.